To set up an accurate protocol defining the areas to be treated and the required amount of fat, a detailed physical and photographic examination of the patient's face and the assessment of her photos in her youth are necessary. The procedure is scheduled after a reflection period. It is performed under local anesthesia. Entry points and areas to be grafted are marked on the patient's face while she is in standing position. In this photo, we can see 6 entry points: nasolabial fold, malar area, cheekbones. Tear troughs are also marked as well as marionette lines. The area of choice for fat graft harvesting is the internal aspect of the knee where entry points and areas to be harvested are marked. The equipment required is a kit containing a 2 mm harvesting cannula, a 0.8 mm injection cannula, and a fat transfer adapter. Some additional equipment is required, such as 14-gauge and 21-gauge needles. The use of a Special 8-hole harvesting cannula with an oval-shaped tip is required. The blunt tip harvesting cannula is also used for local anesthesia. For the injection, a 0.8 mm cannula is required, and the most commonly used is 40 mm in length. With microsampling cannulas, fat cells of approximately 600 micron can be harvested. The local anesthesia of the entry points on the face and knees is performed with 1% lidocaine with epinephrine in a 3 cc syringe and a 30-gauge needle. Once the entry points on the harvesting area have been anesthetized, puncture sites will be made with a 14-gauge needle. The anesthetic product contains 1/4 of lidocaine with epinephrine and 3/4 of physiological serum. 30 cc were injected on each knee and the area was immediately anesthetized. Harvesting can now start. Low pressure has to be applied. The plunger has to constantly touch the adipose tissue. Fat needs to be harvested repeatedly, approximately 30 times, to fill a 10 cc syringe. When 40 cc have been harvested, that is to say 20 cc on each side, adipose tissue is centrifuged at 3,000 revolutions per minute per 1,200 G for 2 minutes. The lower part of the sample, containing the anesthetic product and blood, is eliminated. The upper oily part is always in small quantity, usually some drops. After centrifugation, 18 cc of adipose tissue is left. Facial fat grafting can start. All the entry points are anesthetized with undiluted lidocaine with epinephrine. Fat is transferred to 1 mm luer lock syringes. To prevent air bubbles, the 10 cc syringe has first to be connected to the adapter, and fat is pushed out of the syringe to fill the adapter before being connected to the 1 cc syringe. The transfer can then start. Puncture sites are made from injection angle with a 21-gauge needle to reach the subcutaneous layer. Cheekbones are always the first areas to be grafted. The fat is deposited along the deeper plane next to the bone in microtunnels, approximately 20 to 30 microtunnels per cubic centimeters of fat. Then the deep plane of the chin area is injected. The next step is the marionette lines, the nasolabial folds, the infraorbital rims, and the malar area, which are treated with the subcutaneous placement of harvested fat grafts. Once the left side has been grafted, the right side is identically grafted. The first injection is always performed on the cheekbone. 0.5 cc is grafted in the infraorbital rims. The left index finger is used to check the distal end of the cannula. A total amount of 1.5 cc is injected in the upper lip in 3 purely submucosal areas. The area of injection is accurately delineated between the thumb and the index finger. We can now see the patient at the end of the procedure in the operating room. The procedure roughly lasted 45 minutes and the patient is able to leave the hospital. There has been 2 deep plane areas, the cheekbones and the chin. In the other areas, fat grafting is purely subcutaneous. 16.5 cc is the total amount of fat injected for this patient. 12 days after the procedure, there is no edema and no hematoma is to be observed during the follow-up visit. The next follow-up visits are scheduled 2 months and 6 months afterwards. After 6 months, the fat transfer trophic effect can be assessed.